All right, I got another question from Reddit coming from Penis Questions. This runs from Snoop Sprouts 7947. Male 19. How sensitive should the glands be? If I penetrate a vagina, it's perfectly fine. If someone is sucking me, it hurts and I can't keep going. Specifically, the bottom part of the gland is really sensitive, not in a good way. I do not come quickly penetrating, so the high sensitivity is not a problem apart from the oral sex. Any thoughts?
So it's a good question. A lot of times it's difficult to say this just based on sort of the history of what people are saying, but it does sound like there's probably some issues on the bottom side of the penis. So sometimes the frenulum, and the frenulum can cause discomfort. So it really depends on what they mean by increased sensitivity to discomfort. There are times where the bottom part of the penis with the 6 o'clock is the frenulum can be quite tight, and that when the foreskin is retracted, it causes pain. And now that can happen with masturbation, or maybe you're more careful with masturbation and you notice it more with intercourse or maybe oral sex. And there are times where we either apply steroid creams to thin out that skin to stop that pain, or even a frenulectomy where we actually cut that tight frenulum. So anytime you have concerns like that, it warrants seeing your doctor. Sexual encounters should be a pleasurable experience. The other piece is talking to your partner as well. Maybe they're doing something that may not work with you, and just having open conversation. At the end of the day, sexual activity should be pleasurable for both partners, and you really have to speak to your partner and really figure out, what works with them, what works with you. Now, obviously, this may be a new partner, or maybe you're single. That's something you're not going to bring up on the first date, but just something to be mindful of.
Okay, great. Thanks for the answer.